dialysis?
There are several risks. First, there is this called the first-time syndrome, where when you do the dialysis for the first time, now the body has gotten used to those high levels of ureas, creatinines. Now when you do it, the body is trying to readjust to the normal. So that high gradient, especially in the brain, where those things cannot be removed as fast as the blood is being cleaned. You get some we call it dialysis disequilibrium syndrome, where you get vomiting, nausea, fits. Some patients even go to fits. Yeah, so that
is that during or
during when
after?
you start during dialysis.
Okay.
Some is during, some is after, immediately after dialysis. So that can be treated by usually when you start dialysis, you start with very low speeds, low duration, like you start with 2 hours fast, so that the body can get used to it.
The same.
Then other risks, patients go into hypotension because maybe you have removed too much water. Now the pressure drops very, very fast to very, very low, dangerously low levels. Sometimes patients go into hypoglycemia on the machine. Then the dialyzer removes the waste, removes even the glucose. So patients
That's possible.
Yeah, it's possible.
Okay.
So patients go into hypoglycemia, some infection, since especially with catheters, since it's a foreign body that's in your body. So when you do dialysis, you need to be very, very careful. Maintain a septic technique when handling the catheter and the patient, so you reduce the risk for infection.
Wow. Okay, so understanding this risk, I mean, do you take a patient through these risks, first of all, for them to understand before starting dialysis? And if suppose a patient says, listen, this is too risky, I cannot go through this, are there options for them? Or that is the only option at that time?
Okay, before you start dialysis, you're usually cancelled. We cancel you, we cancel your family, so that we can give you as much support as possible. Because there is really no option. Even if you want to do transplant takes time. You can't do transplant immediately. There's some tests that need to do. So before you do that transplant, you need to do that dialysis. So we actually talk to them, give them support, answer questions to their satisfaction. Yes, the doctor does that, the nurses does that. If a counselor needs to be called, they usually call, so that the patient is fully ready for the dialysis.
What if they say no?
When they say no, we try to talk to them.
Just to give them assurance.
Just to give them assurance that it can be done. Now, what we do, usually it's advisable that you can even tell them to come to the renal unit, see some patients who are usually undergoing the dialysis, maybe talk to people, so that they can gauge the situation and whether they can do it or not, because they have no option, they have to do it.
I mean, and given weighing the risks versus the benefit, I think the benefits...
the benefits usually outweighs the risk.
So it's all worth it. Okay, and then you talked about peritoneal dialysis. Peritoneal dialysis. Okay. All right. So how about we take a break, because it's like we need to internalize all those things and just get to understand. And then when we come back, we'll talk about peritoneal, and of course all these other factors that are associated with dialysis after the short break. So remember to stay with us. If you have any other question, feel free to interact with us. The WhatsApp number is down on your screen. Use it. Ask any question that you have as far as dialysis is concerned, because I'm pretty sure you have a lot of questions. Okay, so just ask them away. We'll forward them to Cedric, who'll be able to answer all your questions as far as dialysis is concerned. But for now, let's take that short break. See you soon. All right, welcome back. Glad you're still with us. The show is My Doctor, and just in case you're tuning in now, today our focus is on dialysis. And of course, we discussed pretty much a lot when it comes to dialysis. Who needs it? When do you need it? And of course, the different types of dialysis. But now we're about to talk about peritoneal, right? And I know it's like big words.